Hey everybody, my name is Wilson Belk and I'm one of the authors on the paper that evaluated PRP or platelet-rich plasma versus hyaluronic acid for knee osteoarthritis. And I'd love to answer a couple questions about this paper that we wrote. The first one being, in all the studies that we included in our analysis, there was a lot of overlap or heterogeneity between techniques that these studies used, a lot of difference in the study methodology here. And so what should studies do in the future to kind of make sure that we keep keep this heterogeneity as low as possible? And for sure, future studies should be randomized. They should try and control for as much as possible so that we can really get the true effect of PRP on knee osteoarthritis. And so as far as having two groups goes, you got one group receiving PRP, one group receiving another type of injection. It could be hyaluronic acid, could be saline, could be nothing at all. And so these two groups should basically be identical in that they've got a similar number of patients that are all pretty similar in age. Their history of injections is pretty similar. So maybe they have no history at all. Maybe they've all received a cortisone shot, but they don't have a ton of a huge difference in injection history. And then the severity of osteoarthritis is important too. You don't want to have somebody who's got 20 years of OA in their knee versus someone who's just had 1 year, right? We want to keep that as similar as possible too. And so the list goes on here. And this way, you can eliminate as many confounding factors as possible. And that'll really help you get the true effect of PRP on knee osteoarthritis. That'll help you kind of see the most raw form of what it's doing. And so the second question here is, for somebody who's trying to conduct one of these studies in the future and they want to keep their study low risk of bias, how can they do that? And so this is actually a pretty straightforward question. Low risk of bias, well, let me say it this way. The higher quality studies that you include in your analysis, the lower your risk of bias will be. And so, this is because the more heterogeneity you have between studies that you're including, whether they maybe the platelet or PRP makeup in their injections is different between patients. Maybe the series is different. So maybe one group of patients is receiving one injection a week for 3 weeks, and maybe another group is just receiving one injection total. And so if we keep that the same, then we'll really be able to kind of increase that quality of study. We keep it randomized. We got a lot of patients in there. All the techniques, the study methodology is the same. The treatments are the same. The patient demographics are the same. Then we can really lower the risk of bias. And so if someone is really trying to conduct a study with a low risk of bias, a systematic review, a meta-analysis, whatever it is, you just want high quality studies, as high of quality as you can. Level 1 evidence, level 2, nothing over level 2. And so this is kind of a good way to keep these variables as restricted as possible and get a good handle on it, and that'll help you conduct the best study that you can.